You need vitamin D for many reasons. Vitamin D is essential for the body's health and functions related to muscles, bones, and nerves. But many are deficient in vitamin D, especially in the cold winter. What can we do to increase the vitamin D level in our body? Sunlight exposure. Basking in the sun is the most effective way to synthesize vitamin D through the skin. When ultraviolet rays reach the dermis, the 7-dihydroxycholesterol in skin cells is converted into vitamin D3, and these absorb UV radiation and are transformed into various photoproducts, some of which have unique biological properties. But the sunlight in winter is less strong than in other seasons. We need to increase the time for sunlight exposure to compensate vitamin D synthesis. I highly recommend taking 30 minutes walk at least twice a week and going outside to enjoy the sun during lunchtime. However, just sitting by a window on a clear day is not as effective as working outside. It is known sunlight exposure through the window is of little use of vitamin D synthesis. Ultraviolet rays reaching the surface are two types, UVA and UVB. Among them, UVB is related to vitamin D synthesis, and most of them are blocked by glass windows due to its short wavelengths. Eating vitamin D. Perhaps it is the most simplest way to increase vitamin D level. During the winter season, the sunlight is not enough to fulfill vitamin D, so supplements through food are somewhat necessary. There are plenty, such as milk, cheese, eggs, and mushroom. And fatty fish like salmon and mackerels are also rich in vitamin D. One glass of milk contains about 120, one medium-sized egg is about 40, and 3 ounces of salmon has more than 500 international units of vitamin D. Vitamin D is an essential nutrient for maintaining a healthy body function such as muscles, bones, and nerves. It helps calcium absorption, increasing bone density and strengthening bone. Nerves are needed to send signals between the brain and the body and help muscle movement. It stimulates insulin synthesis and secretion by controlling calcium and phosphorus level and directly affects pancreatic beta cells. It also has the effect of boosting immunity. Therefore, a lack of vitamin D can lead to osteoporosis and sarcopenia, which reduces iron absorption and increase the risk of anemia. However, be careful to take too many of vitamin D because excessive doses of more than 10,000 international units per day may cause toxicity. No need to worry about vitamin D deficiency if you are often go outside and are exposed to the sun every day and eat fish or vitamin D fortified food. However, people with low outside activity in winter who only live in a room and have no sunlight exposure or over the age of 70 need to take vitamin D through adequate supplement. They are likely to lack vitamin D in the body because their body can't make enough for poor synthetic ability. Aging actually affects the formation of dihydroxyvitamin D, calcitriol, the active form of vitamin D. In general, it is recommended 800 IU daily for the form of vitamin D3.